I'm with Professor Abdallah Daar, University of Toronto and Grand Challenges, Canada. Hello.
Hello.
What are you discussing this year at the World Healthcare Congress Middle East?
I'm on two panels. The first one in about an hour is on innovations in healthcare, and the second one is on diagnostics and new ways of discovering diseases and treating them. And my work with my colleagues at the University of Toronto and Grand Challenges, Canada, is focused on the intersection between life sciences, so biotechnology, genomics, etc., global health, and entrepreneurship. And by global health, in our work, we mean the health of people in the developing world. The majority of people, 80 to 90%, live in the developing world, otherwise known as low and middle income countries. And we work to identify ways of taking knowledge rapidly from the laboratory to the village where it's needed. We have a recent book called The Grandest Challenge, which is about that subject, and I'll be mentioning it during my presentations. But the focus is on the health of people in the developing world. However, there are low-cost, frugal models of healthcare delivery in the developing world which the developed world can learn from. An example, there is an eye care system in India called the Aravind eye care system. It does a lot of surgery for the eye and eye care for poor people, half of whom don't pay. And they provide that care at a level which is exactly the same as in the United Kingdom, if not more, at 1/100th of the cost.
Wow.
So we have something to learn from those kinds of low healthcare model for people in the developed rich world, including here in the Gulf, how to cut costs. And it's really important because in many places like the United States, Canada, and probably here too, healthcare costs are mushrooming so much. We have to innovate in finding ways of reducing those costs.
Why do you think such an event is very important?
Well, it brings together people from industry, from academia, from health systems, politicians and policymakers. Not many events succeed in bringing all those kinds of stakeholders together. And particularly policymakers. Policymakers need to understand what are the innovations taking place, what are the possibilities for them to change policies to make this a better world, to improve the health of their people. And they're usually very busy people. They react to crises most of the time. When they have an opportunity like here to meet people who are thinking about potential solutions, I think that it gives them an opportunity to reflect and begin to think long-term as opposed to short-term.
What are some of the things your organization is doing to face healthcare challenges?
So one of the things that we do, and that's the Grand Challenges part of my work, Grand Challenges Canada, is we fund research on a large scale to find solutions to problems in the developing world. And unlike other funding agencies, research funding agencies, we actually fund researchers in the developing world. There are many good people with great ideas, and they don't get enough research funding. The organization that my colleague Peter Singer is the CEO of, and I am the chief scientist of, is Grand Challenges Canada. The money comes from the federal government of Canada, from its foreign aid budget. And it's the first country that has ever done anything like that. And what we do is we fund really good research. For example, in global mental health, that's needed here, in making sure that mothers and children, when they are born, survive, in discovering new ways of diagnosing diseases, etc., etc. We do that sometimes in partnership with USAID, the Gates Foundation, the government of Norway, the World Bank. We try and do things that are out of the box, very creative, very innovative, that will have impact rapidly.
And what do you hope to learn or teach in such a conference?
I think there is a lot to be learned. There are really quite a lot of very enlightened people here. Lord Darzi, for example, you might have met him. I'm keen to see what innovations they are bringing to the formidable problems that they are faced with in making healthcare systems better.
Dr. Abdallah Daar, thank you so much for being with us, and we're looking forward to your second panel.
Thank you very much.
Thank you.